Merry Christmas.
Merry Christmas, Remark nurses. I hope you had a Merry Christmas. Open and bring gifts.
Huh? All right, this is the camera. Wait a minute, guys. Wait a minute.
Wait. Merry Christmas, Remark nurses. I hope you had an awesome Christmas with your family, opening your gifts from Santa. Merry Christmas, nurses. Merry Christmas, future nurses. And I hope you had a good time enjoying this year using our program. If you did not, I hope you get it soon. And this is our 7 days of NCLEX.
7. Yes.
Yeah, even I got it from Christmas.
All right. Shiloh got that for Christmas. What else? This is Sayla's first Christmas. So I'm really excited because this is her first Christmas and it went very well. Got my first Christmas swag on. Yay, Sayla. So obviously my kids are not quite settled yet, and it was time for Winning Wednesday. And you guys know I am about just showing up no matter what. So we're going to show up and then we are going to see how far we get. Michael is also here. Where are you going, Michael?
He's grabbing his phone so he can play.
Oh, okay. Well, we're not playing Kahoot tonight. There's no Kahoot.
Unfortunate.
So what we are going to do is talk about we're just going to talk about pushing through, y'all. We're going to talk about in 2024 how we are still remaining focused to our goals no matter what else. Yeah, no matter what else is happening, we have a mission. And the reason why we're so committed is because there are people who are depending on us to accomplish these goals. And so for many of us, we are parents, but even if we're not parents, we still have a goal that we need to get through. So Merry Christmas, nurses. I intend to talk about glaucoma tonight. And glaucoma is one of the subjects that's in Quick Facts. I'm not going to belabor the topic, but I do think that there are some important points that we need to consider as we approach this. Yeah, it's a keychain. No, this is a necklace. This is the necklace that goes around your neck. Okay.
Around my neck?
All right.
How do I do it? And
Also, don't forget, guys, that tomorrow the 7 days of NCLEX begins. And last night, I sent out the workbook for the 7 days of NCLEX. So Merry Christmas. That was my gift for you all. This is the workbook. And I know you have so many things going on, but this workbook must be, hold on one second. This workbook, you need to bring it to the 7 days of NCLEX. Okay. Everybody, good night, everybody.
Good night.
Good night, baby. Love you. You gonna leave that here for the Remar nurses?
I want to, but I do.
Okay.
I want to.
Well, it's definitely time to go to bed. Okay. It's definitely time to go to bed.
Okay.
Okay. So one moment, guys. So one of the things. Oh, I don't think they saw you, Michael.
Night, Remar nurses.
Night, Remar nurses.
Okay. Good night. So that means you actually are going to bed. Okay. So as I was saying, Sayla, you ate the bottom of my butt. This workbook you will be bringing with you starting tomorrow night at 8 p.m. is when we're doing our first shift for the 7 days of NCLEX. So make sure that you print this workbook out. If you need to go to Staples or Kinko's, they will be open tomorrow to have this printed out. All right. You don't want to come to class without this. What else? Other things. All right. So we're going to talk about glaucoma tonight. Please get out Quick Facts and let's look at where it is in Quick Facts. Because I kind of want to just make sure that when you're reading Quick Facts, you understand the perspective of this condition. Because it's easy to look at the points. Oh my goodness, no. It's easy to look at the points and just be like, okay. But there are some page 39, that's where I am. There are some very important points about glaucoma that if you can understand them from the beginning of a case study, that you will be able to anticipate the emergencies. So when we talk about glaucoma, we are talking about an eye condition, but more importantly, what is the cranial nerve that we are looking to identify with? What is the cranial nerve that we are looking to identify with? What cranial nerve is involved? Oh, this is so good. Okay. So I see the comments on screen. And let me know where you are from, because it's Christmas night and I am noticing that we have our faithful visitors that are like, I'm going to study no matter what. And I love that. So we're talking about the optic nerve. Okay. Which cranial nerve is that though? Which number is that? I got California in the house. Always faithful. 8. Chicago, also Mississippi. Hey, I got some people here. Okay, Ohio. I'm representing Ohio too. Merry Christmas, everybody. Merry Christmas. Yep. All right. Thanks, Mark. So you didn't get your workbook in the email. So I think I'll post the direct link for you to download then for some people, because I got mine. Cranial nerve number 2. Cranial nerve number 2. So when people typically talk about glaucoma, they will fail to mention that what glaucoma really is a it is a progressive loss of vision due to an issue with cranial nerve number 2. So glaucoma involves the cranial nerve, the optic nerve. All right. So when we're looking at it, I'm just reading from Quick Facts. How does glaucoma affect vision? It becomes blurry and the patient experiences tunnel vision. There will also be halos and there will also be light. Now, when we talk about glaucoma, there is a push for us to remember high blood pressure, like intraocular pressure. That's the big thing. So let me see, what other questions do I have here? So which cranial nerve is involved? It is optic cranial nerve number 2. And then, this is okay. Before I go here, I do want to show this slide, but I want us to think about glaucoma not only being increased intraocular pressure, but essentially it is a group of conditions that are going to lead to damage to the ocular nerve, which will lead to progressive blindness. And the thing about glaucoma is that you can have glaucoma, because remember I said it's a group of diseases. You can have glaucoma apart from that increased intraocular pressure. And this is just background knowledge for you to be more comfortable talking about this condition, because I think, in the beginning, when we're learning about this and it's introduced to us in nursing school, glaucoma is always associated with increased intraocular pressure. And that's what's pushed to the forefront of our minds. And we forget that there is a blockage happening. There is a decreased drainage capacity in the eye, which then damages that optic nerve. So the blindness is that is the real problem with glaucoma. So I have here, glaucoma is a group of ocular diseases. Remember I said it's a group, it's not just one thing, resulting in increased intraocular pressure. And then that increased intraocular pressure, it's the aqueous humor pressure in the eye, that fluid is increased. So we have a normal intraocular pressure is 10 to 21 millimeters per mercury. So we're going to have an increased number there. And so what happens is the high pressure in the eye happens when the fluid in the eye can't drain properly or too much fluid is made. And so this pressure harms the optic nerve and this can cause blindness. So glaucoma is blindness that a patient is going to suffer from. Lily D says, hello, Regina and Mark. I passed my NCLEX on December 19th. This was the best Christmas gift I received from my Heavenly Father. I would like to thank Remar team for all that you do. And I appreciate that so much, because I do want for when you to reach out to the Remar team for there to be a response by the Remar team. So that is something that I'm really proud of. We are available on so many platforms to reach out to you. All right. So the risk factors, who can get glaucoma? So it's a person with a family history of glaucoma, persons with thin corneas, those who are African American in descent or race, patients with diabetes mellitus, patients with myopia, nearsightedness, migraine syndromes, cardiovascular disease, those who have older age. So increasing age, this can be an issue. If you've had any eye trauma, which may damage the eye, or did you know this, that if a patient has prolonged use of topical or systemic corticosteroids, this can actually affect how the eye drains fluid over time. And so that puts your patient at risk for increased intraocular pressure. Now, remember I said glaucoma is a group of diseases. Well, the two types here that I want to discuss are primary open angle and primary closed angle or closure glaucoma. Depending on what you read, you may have it termed something different, but we say open angle, closed angle. Okay, so let's look at open angle. Have you heard of it? If somebody asked you what it is, can you describe it? So open angle glaucoma results from an obstruction of outflow of the aqueous humor. And this is the most common type of glaucoma. Okay, so this is the slow type of glaucoma. And primary closure or closed angle glaucoma, this is more of an acute issue. It results from also blocking the outflow of aqueous humor, but this type is painful. This type is painful. So open angle, typically there's no pain. You know, when you think about hypertension, how it is like a silent killer, we call high blood pressure a silent killer. This condition as well can be called a silent route to blindness because, hey, how about this? The patient may not even know that the intraocular pressure is increasing. And then all of a sudden they start having these complications. So make sure that we are aware of that. This is a progressive condition. Our pharmacological treatment is going to be cholinergics. These medications increase aqueous fluid outflow and cause miosis, which is constriction of the pupil. This is going to help to drain the eye properly. It will reduce the pressure in the eye. Same thing as the adrenergic agonists. What they will do is they will reduce the production of aqueous humor, okay? Also increasing the outflow. And beta blockers, yes, beta blockers are going to reduce the fluid in the eye, decrease the aqueous humor production. And again, you can read more about this in Quick Facts for NCLEX, page 39. Your nursing management is going to include instructing the client on the importance of medications to do what? Constrict the pupils. Miotics also decrease the production of aqueous humor, and then decrease the production of aqueous humor and increase intraocular pressure, such as beta blockers. All right. And we also are telling the patients that once they begin taking this medication, this is a lifelong medication. So put this in the class of your like thyroid medications, where once you start taking them, your cholesterol medications, people usually continue to take those for the rest of their life. So lifelong medication use here, avoiding anticholinergic medications to prevent increase in intraocular pressure. We're contacting the doctor before taking these medications, including over-the-counter medications. I'm talking about glaucoma here. And then also, if you're doing a diphenhydramine or a loratadine or fexofenadine or ceridazine, these can also interact with your glaucoma medications. So during the holidays, this type of information is very hard to get into. You probably don't feel like studying. You don't feel like, really opening up your book and sitting down taking notes. But that's why Quick Facts is like the book that you can just do it. Even if it's just 5 or 10 minutes, be in this book. Make it into a workbook. Take notes on it. You will thank yourself for doing that. On Christmas Day, we're basically just studying from Quick Facts. All right. Also, the patient should report any eye pain, halo around the eyes, and changing vision to the healthcare provider. I'm going to give you some questions about glaucoma here in a minute. We are also instructing the client when maximal medical therapy has failed to halt the progression of visual loss field and optic nerve damage, then surgery may be recommended. It is a very delicate surgery. So the patient is going to have to make that decision about what's best for them. Hey, before I get into the NCLEX questions, I want to remind you that the 7 days of NCLEX starts tomorrow, and we will be right back here at what time? What time will we be tuning in? 8 p.m. Eastern Standard Time. I'm going to be here teaching a course specifically for you to increase your critical thinking, and it's free for 7 days. So tomorrow we have our first shift. Our patient's name is Robert Hughes. If you have the workbook, okay. And of course, if you don't have your workbook, it's okay to come to class without it. But I just feel like the workbook helps you to stay more engaged. So do me a favor, if you have your workbook tonight, just look over Robert Hughes. This is your patient. These are the medication. These are the lab values and the vital signs of your patient. So you can get familiar with your patient starting even tomorrow before class starts. So let's get into, and Merry Christmas, everyone. Tell me what your favorite gift is that you got today. All right, NCLEX question style. Here's our first question. It's this. A registered nurse is caring for a 35-year-old female client with open angle glaucoma. What assessment finding is not present with this type of glaucoma? What do we say? Number 1, severe bleeding. 2, cloudy vision. 3, tunnel vision. Or 4, increased intraocular pressure. Okay. A blender. Ooh, so good. A blender. All right. What do we say here? Oh, you know what? You guys are right. There's actually 2 answers here. I just realized that. And I changed this question before I got on here, and I realized that I made a mistake here when I changed it. So, oh, quick facts for NCLEX was your favorite gift. How cool is that? Ice cream machine maker. That's pretty cool. So the correct answer would be, it would be 1 or 2. It would be 1 or 2. And somebody saw that. Sorry about that. So definitely bleeding is not that's one of the answers. I just put bleeding in there, and I didn't realize that I wanted to make it a select all that apply question, but I didn't put select all that apply. So either 1 or 2, because we don't see severe bleeding in open angle glaucoma, and we also don't see cloudy vision. Cloudy vision is more so in cataracts than we would have in glaucoma. Okay, so it's Christmas, guys. It's Christmas, and I was doing this extremely tired. I'll just be honest with you. I didn't sleep at all last night. Maybe 2 or 3 hours. Mark let me sleep for 2 or 3 hours. Yeah. And then we had to get up and we had to wrap gifts and just all this good stuff. So I apologize for that. No bleeding, cloudy for cataract. Pandora bracelet, Pandora charms. My mom got me 2 Pandora charms today. So they're really pretty. Thank you. Thank you. Thank you. All right. Let's try another question. Cheryl says she didn't sleep either. Which client is at the highest risk for developing glaucoma? That's what we're talking about. Number 1, a 50-year-old Caucasian woman with no family history of eye disease. 2, a 30-year-old male with a history of hypertension. 3, a 65-year-old African-American man with a history of glaucoma. Or 4, a 20-year-old female with diabetes. This is good. Who's most at risk for developing glaucoma? You know those risk factors. Hey, you guys got this one. Easy peasy. It's Christmas night. We are just going to do our studying, and then we're going to go back to enjoying our family, because we got to get ready for 7 days of NCLEX. We got to get ready for that. And that's tomorrow. Correct answer is, boom, 3, 65-year-old African-American man with a family history of glaucoma. Great job. Yep, great job. African-American. Yep, older age, family history. This person is most at risk. What about this? Any payment plans for your program? We're actually working on a payment plan for the program. So it's a buy now, pay later option. The developers showed me that it's halfway done. So Of course, you can have the ability to do it, but we have to be able to see your account and be able to help you if you have any issues and track your history so you can see it too. So we're almost there. Okay. 2025, which is in a couple weeks, we should be rolling that out. Because I know that once if you buy it now, once you get a job as a nurse, you're going to be able to pay anything back. And that's like one of the great things about being a nurse. All right, let's do this question. A patient with glaucoma asked if they can drive. What is the best response? Number 1, you can drive as long as your vision is unaffected. 2, you should avoid driving altogether. 3, driving is allowed if you wear sunglasses during the day. Or 4, you need to speak with your doctor for this matter. This is a good one. This is a good one because why? Because we need to have the best response by the nurse. And remember, NCLEX is looking to see your competency in a certain area. So I'm going to show the answer. So the correct answer is 1. You can drive as long as your vision is unaffected. All right. Patients with glaucoma can drive if their peripheral vision and reaction times are adequate. Remember, what do we know about glaucoma? Glaucoma is progressive and it's silent. Okay. So that means that you can have a very early diagnosis of glaucoma where you don't have any vision problems and you are taking medication to control that pressure, right? Or you can have a progressive end-stage glaucoma where there is blindness. The issue here is that the patient is coming to the nurse with a question. What is the reason why 4 is not the answer? Because many people picked number 4. Like just very quickly, I saw it in my comments. I just saw like 4s. Why is number 4 not the best response? Is it a response? Absolutely, it's a response. But is it the best response? Yeah, pretty much. You got it. Because the patient is coming to you for a concern. And it is something that you are equipped to talk about as the nurse. So to dismiss the patient and say, you need to talk to your doctor about this is not appropriate. It's not appropriate. Okay. Because what it shows is that you are not familiar with the education of this subject. And so we already know it. We know glaucoma is progressive. So if the patient doesn't have any vision problems, they are able to drive. They're able to drive. Okay. All right. So I think I just had 3 questions for tonight. That's right. This topic comes from the V2 NCLEX review program, which I encourage you all to take up the challenge, get in that program. You can do it in as little as, I used to say you can do it in as little as 1 month, but people are doing it in 2 weeks. So you can do it in as little as 2 to 3 weeks to make sure that you have all of your bases covered for the NCLEX. And especially if you are an audio-visual type of learner who likes things explained to you, this is the course for you to take. We have a lot of great programming happening this week for you here at Remar Review. Also into the new year, 2025 is going to be big. Okay. It's going to be so big. And so subscribe to the YouTube channel or the Facebook page so that you can follow along into everything that we're doing. Like 7 days of NCLEX, it starts tomorrow night, 8 p.m. If you have not signed up for it, please go to remarnurse.com/7 days. We will be running a promotion. For the V2, and it is a Christmas sale. And so I see here the Christmas sale should start tomorrow, but I saw here that there's a promo code somebody put in the comments. I'm trying to find it. I know I have some Remar reps here. If you are a Remar rep and you have a discount code for an additional percentage off of the V2 program, please post it right now so I can put it up for people. If you are going to, the 7 days of NCLEX ends January 1st. So the sale will be until January 1st. Can we, okay, so here's one, Nurse T. And let me just check to see if I can, let me check. People are asking for the download. Hold on one second. Let me look. I'm going to go into my 7 days of NCLEX workbook. Okay, wait, that's the one. Okay, here's a workbook. Let me see if I can download it. Let me see. I actually got like 3 emails about this workbook here. Okay, let me see. Let me copy this link. It's going to be a long link. It's not going to be pretty, but I'm assuming right now y'all don't care about that. Let me post it. All right. Tell me if you see this link. Okay, there's two links that you can click on and get the workbook. Okay. You see it? Also, Nurse T says if you put in Nurse T, then you are going to be able to get an additional discount on the V2 training platform. So we did the Secret Santa and I did the discount on the books, which were $15 for the Quick Facts series. So now it's time to go back in. Okay, now it's time to go back in and make sure that you all have the V2 program. I also brought the V2, but can't download the book that was sent to me in the package. Okay, so if you're in the file vault, remember that you need to have a PDF reader on your computer because the books in the file vault and the quizzes and all that good stuff are PDFs. So if you don't have a PDF reader, then it won't be able to convert that. Got it? Okay. Okay, hold on a second. It downloads. Okay. Hi, I signed up for the nursing school subscription, but it's not letting me renew. So the nursing school subscription is 3 months. Is that the one that you purchased? Let me know. Oh, I passed my NCLEX RN using Quick Facts and V2. That's the winning combination. That's what that is what I suggest for people to do. I'm so glad you took the recommendation and you actually purchased the program, went through the program, and got your nursing license. So good. All right. Oh, Merry Christmas to you. Yes. Okay. So perfect. Thank you so much. Being here on Christmas is a big sacrifice, honestly, if I'm being honest with you guys, but seeing comments like this make it worth it for me. I love the V2 program, so easy to understand, and I really appreciate the short videos. Yes. And I'll say this about 7 days of NCLEX tomorrow night. I am planning for this class to be just from 8 to 9 p.m. That's it. Like, I don't want the class to be long every night. We have to go back to back 7 days. So I want to definitely be able to appreciate your time and make sure that I'm on time too. Okay. I want to purchase V2, but I'm taking my exam in May. When should I buy the program? So I'm assuming you might have exit exams. So what you can do is, even if you purchase the program now, you can delay your start date for up to 90 days. So if you take advantage of the discount, you use a promo code, you can delay your start date until, probably until late February, maybe beginning of March, I'm not sure. And then you can be studying for your exit exams and your NCLEX at the same time if you start in March. Okay. All right. That's okay. I'm glad you're here. I'm sorry. And it's okay that you're at work. You didn't catch me. It's okay. It's all right. You showed up. We're just talking about tomorrow. I don't know if you work, Doris, tomorrow, but tomorrow's the 7 days of NCLEX. So hopefully you can make it. Okay. Hello, I brought the V2 book in the subscription on Thanksgiving holiday sale, and I bought Quick Facts on July, but I didn't receive the V2 book. And who I have to contact, please? Okay, so let me, you can contact Team Remar, and the email is support@remarreview.com, but let me give you the phone number, okay? Because you can call, and who you will speak to is Jane. I'm looking for the phone number. I'm just gonna say the phone number. Can somebody put it in the chat for me? Our telephone number for Remar is 855. So it's 1-855-909-1901. That's the phone number. And the hours are Monday through Thursday, 8 a.m. to 5 p.m. Eastern time. Okay. So you can give us a call on the phone number. I heard you guys say that we want to have somebody to talk to on the phone, so we got a phone number. All right. Okay. Thank you, everyone. Best Christmas gift ever was passing your NCLEX. Absolutely. So what time is that in Pacific time so I can put on my alarm? So if you are on the West Coast, you're going to come at 6 p.m. Thank you so much. Thank you so much. There it is. That's the phone number. How can I get V2? It's easy to get V2. V2 can be purchased by going to remarnurse.com, and you will pick whether you're an NCLEX preparer or you're in nursing school or you're in T's and HESI. Okay. All right. What else? I haven't checked my exam yet. Number 3, I have people coming in doing the questions. So many comments. All right. So it is Christmas Day. We do have a class on tomorrow, so I don't want to keep you. I want to make sure that you are using every opportunity you have to enjoy the blessings around you. I would just say print out that workbook and let's get ready to start for tomorrow night at 9 p.m. I will see you all there. God bless you. Yes, there is a phone number for Remar. Yeah, there's been a phone number for a while. Okay. There's been a phone number for a while, so I want to make sure that you have it so you can call. Good evening, everyone. Good night. Have a wonderful sleep and rest, and let's get ready for tomorrow. I'm trying to think, is there any more announcements that we have coming up? Nope. That's it. Can I join the 7 days even though I didn't study yet? I didn't apply for NCLEX. Yes, absolutely. Yes, you can. 7 days of NCLEX. Where are these people? We got some people on here today that are just trying to make trouble. I got to ban them. 7 days of NCLEX are for nursing students or anybody preparing for NCLEX. So even if you don't have my program, even if you don't have any of the products, you don't have Quick Facts or anything, you can still join 7 days of NCLEX. It's free. It's right here where you're watching. Just show up tomorrow at 8 p.m. and be ready to participate. Yeah, absolutely. It's on Facebook Live. So as I go into the new year, I may start doing exclusive events just inside of the V2. So the programming that I do, I might just do it inside of V2. So you have to have access to the V2, but this is not one of them. This will be live on Facebook or YouTube. I got my t-shirts. Love them. So cool. Yes. Thank you so much. I wear my Remar shirts all the time too. It's like a second uniform to me. Okay. All right, everyone. So I will see you all later tomorrow. Remember, if you haven't signed up for 7 days at NCLEX, it's not too late. Just go ahead and go to the website, remarnurse.com/7 days. Merry Christmas, everyone. Good night.